Hi there, so today we're going to look into the 10 theorems of retention, of which 9 are put forward by Riedel and the last one by Moyer. So let's look into the theorems one by one. First one goes like, teeth that have been moved tend to return to their former position. So here it is beyond doubt that the teeth have tendency to revert back to their original untreated position after orthodontic treatment. This is particularly true for rotations. Second theorem states that elimination of the cause of malocclusion will prevent recurrence. So this is true particularly in cases of malocclusion where the cause is obvious, such as thumb sucking, tongue twisting, etc. So here the cause should be identified at the time of diagnosis and should be eliminated. If not, the relapse potential will increase. Now the third theorem states that malocclusion should be overcorrected as a safety factor. Well, this is practiced in treating certain conditions such as rotations, class 2 malocclusion, class 3 malocclusion. And this is done so that even if some amount of relapse occur, there is a normal occlusion achieved. Now the fourth theorem states that proper occlusion is a potent factor in holding teeth in their corrected positions. So we need two things apart from aesthetic aspect. First, correct intercuspation, and second, proper functional occlusion. Now coming to the fifth, bone and adjacent tissues must be allowed to reorganize around newly positioned teeth. It's like if we migrate to a different country, we will need some time to get adjusted, to learn about the restaurants nearby, their culture, get new friends there. Basically, to form our own cozy place, we need time. Just like that, the supporting tissues takes time to reorganize to the newly corrected positions here. Coming to the sixth point, if the lower incisors are placed upright over basal bone, they are more likely to remain in good alignment. So here the orthodontist should aim at positioning the lower incisors perpendicular to the mandibular plane or even retroclined. Now the seventh one goes like, corrections carried out during periods of growth are less likely to relapse, which means orthodontic therapy should be initiated at the earliest possible age, because during this stage, the active growth period will allow the tissue system to adapt very well, and hence it will reduce the relapse potential and giving a good treatment outcome. Okay, now theorem 8 states that the farther teeth have been moved, the less likelihood of relapse seen. This theorem is strange in logic and there's no particular evidence to support it. Now the ninth one states that arch form, particularly in the mandibular arch, cannot be altered permanently by appliance therapy. This is because alteration of existing arch forms result in increased risk of relapse. So according to Macaulay, the mandibular intercanine and intermolar widths should be considered as a fixed landmark, and rest of the arch should be built around them. Finally, theorem 10 stated by Moyer, many treated malocclusions require permanent retaining devices, as certain malocclusions might require patients to be fitted with a permanent retaining devices. So that was all about the 10 theorems. I hope you understood a bit. Now the challenging question is how to remember these, because for your NEET they could ask you any particular theorem, okay, and you need to learn it in the correct order. So I'm going to tell you an easy mnemonic to remember this. Yes, so as you can see on the screen, riverside explorers observe peaceful boats leaving Great Ferry at Attraction Pier. So as you all can see, I put a relatable picture as the background, so you can remember this by seeing the picture. So the words you need to remember are return, elimination, overcorrected, proper occlusion, bone, lower incisors, growth, farther, arch form, permanent retaining devices. And the mnemonic goes like, riverside explorers observe peaceful boats leaving Great Ferry at Attractions Pier. So for NEET, they can ask you which is theorem 6 of retention stated by Riedel. So you can always remember it's lower incisor leaving. So that is, if the lower incisors are placed upright over basal bone, they are more likely to remain in good alignment. So this is how you remember the theorems. So if you understand the concept and learn using the mnemonic that I've mentioned, this topic will be easy for both your finals and for your NEET exam. So that's all for today's lesson. And if you've got any better mnemonics, you can let me know in the comments section.